How can you prevent spinal headaches after a lumbar puncture? Imagine getting a lumbar puncture and then dealing with a pounding headache that worsens when you sit up and gets better when you lie down. That's often a spinal headache or post-lumbar puncture headache. The good news is, there are proven ways to reduce your chances of experiencing this uncomfortable problem. One of the most effective strategies is using special needles called atraumatic or pencil pit needles. These needles are designed to cut less tissue, which means they cause less damage and reduce the chance of cerebrospinal fluid leaking out. Smaller gauge needles, which are thinner, also help because they create a smaller hole in the dura, the covering around the spinal cord. Limiting the number of attempts to no more than 4 can also prevent unnecessary tissue trauma and leakage. The way the procedure is done matters too. Performing the lumbar puncture with the patient lying on their side in a curled-up position is preferred. This position helps make the puncture easier and safer. When withdrawing cerebrospinal fluid, doing so gently without applying suction reduces the risk of causing a leak. Collecting an appropriate volume of fluid, usually up to about 30 milliliters, is safe and helps prevent complications. Certain patient factors can influence risk. Younger patients, especially women under 40, and those with a history of headaches are more prone to spinal headaches. It's important to inform these patients beforehand and educate them about symptoms. Promptly reporting headaches after the procedure allows for quick management. Post-procedure care is also key. Contrary to older beliefs, staying in bed for a long time does not prevent headaches and might even increase the risk. Early mobilization is safe and can help you recover faster. Drinking fluids, whether orally or intravenously, has not been shown to prevent headaches effectively, so routine fluid intake is not a guaranteed method. Patients should avoid strenuous activities on the day of the procedure but do not need to stay flat for extended periods. If a headache does develop, lying flat often relieves symptoms because of the postural component. Mild headaches can be managed with hydration, over-the-counter pain relievers, and anti-nausea medications. For headaches that persist beyond a few days or become severe, a procedure called an epidural blood patch can be performed. This involves injecting your own blood into the epidural space to seal the leak and stop the headache. In patients with leukemia, lumbar punctures are often done to analyze cerebrospinal fluid for leukemic cells. These patients may have additional risks, such as low platelet counts, which can increase bleeding risk. Therefore, careful technique and thorough pre-procedure evaluation are especially important. Preventing spinal headaches in these patients is vital to avoid additional discomfort during their treatment. In summary, using the right needle, minimizing puncture attempts, educating patients about symptoms, and avoiding unnecessary bed rest are key steps to prevent spinal headaches after a lumbar puncture. Following these evidence-based practices helps ensure a safer and more comfortable experience. Always remember to discuss any concerns with your healthcare provider, as they can tailor strategies to your individual needs.